Welcome to the How to Health podcast. I am Dr. Lori Marbus, and I'm so excited to have Dr. Harold Koenig with us today. How are you today, sir?
Good, Lori. Very good.
Well, thank you for joining us. I know you're super busy and we have limited time here, but I just wanted to tell everyone about what you do. So you're Director of Center for Spirituality, Theology and Health, Professor of Psychiatry and Behavioral Sciences, Associate of Medicine at Duke University Medical Center, and you had over 500 publications. You're in books. You've written a new book, too, that's called You Are My Beloved, Really. That's on Amazon. I'll put the link about that. But today we are really going to just dive in quickly about spirituality and faith and kind of what that does with our health. So could you just give us a little background about why you became interested in why you even thought there would be even a connection between a faith or spirituality and our physical health or outcomes?
Well, initially, I was seeing patients as a family physician and caring for them in the hospital, and I was very interested in how they were coping with their condition. One reason is because I had been trained as a nurse prior to being a physician, so nurses were always, more sensitive to how the patient was doing. So I carried that along with me in my medicine, activities, and many people would talk about their religious faith in helping them to cope. And I was intrigued by that. This was now probably over 30 years ago. And there had been very little research, especially among medical patients, on how they were coping and the role that their religious faith played in that. And so I then began to do some systematic studies documenting the frequency that people rely on their religious faith, and then began to look at the connections with their physical and mental health to see whether or not those who were relying more on, prayer and God and faith, whether they were actually coping better and were healthier, were responding more quickly to medical treatments. So that's how I kind of got interested.
So you were a family doctor before you ventured into psychiatry?
Yes, I was a family physician prior to, diving into geriatric medicine and then psychiatry. So it's been a nurse, actually an orderly, then a nurse, then a family physician, then a psychiatrist, and that's what I'm doing now primarily.
Well, I think that's actually a really good mix because with family medicine, that's what my training is. It's we needed a little bit more psychiatric training for sure.
It was a great mix.
It's a fabulous idea, and that's why I think I'm so intrigued with psychology and positive psychology and health. And but with that, what did you find? So as you began to study this, and what were the outcomes that you were seeing, and did anything surprise you?
Well, one of the first findings was that many people rely on their religious faith. When you look at it systematically, when you kind of, do consecutive samples asking patients who are consecutively admitted to the hospital or coming into the clinic, what role does your religious play in your coping with illness? And very, very high percentages of people in the 80% range, at least in the United States, are going to talk about their religious faith, and some of them will actually bring it up, even if you don't ask them. They'll just bring it up. So that was one of the first findings, was that for many patients, it's one of the most important factors that keeps them going. Mm-hmm. And then I began looking at depression. So it seemed like depression was less likely among those who are more religious. And they were also happier and friendlier. And we measured and documented all those things and published them in mainstream psychiatry and medical journals, that religious people really did better than those who didn't have a religious faith when they encountered really difficult situations, particularly with regard to their health. And then more research wanted to understand if that affected their physical health and their recovery, and then found, in study after study, that patients were recovering faster. Their immune systems were actually measurably better, when looking at inflammatory markers. Their blood pressure was lower, and they were living longer. They were living longer, significantly longer than. One of the things about mortality, of course, is it's a cumulative, indicator of a health effect, because it's kind of accumulates. These effects of religion accumulate across the lifespan, and so influence mortality.
Wow.
So those are the kinds of examples of studies that we've done. And what's very exciting, which surprised me in many respects, is that other research groups have found the same thing. And within the last year or so, the Harvard School of Public Health has documented these very same relationships, and lower depression, less suicide, greater longevity. And that's been kind of exciting to see, another very high prominent research group reporting these same findings in medical journals, JAMA. So, that's
Wow.
exciting.
That is exciting. So your findings are reproducible, which is incredible.
Yeah, that's kind of neat.
Yeah. So I'm curious. So when you said you were studying religion or religious practices, was there any particular practices or religions that you found to be more beneficial to individuals, or was it across the board, Judeo-Christian, Islam, Buddhism, whatever? What did you find there? Any differences?
Well, first of all, most of these studies are in Christian populations, simply because, English-speaking countries that can afford to do research tend to be majority Christian. So it's probably, about 80, 85, maybe 90% of these studies are in Christians. Now, in terms of activities, for some reason, religious attendance seems to be one of the most powerful predictors. Frequency of attending religious services, along with this characteristic called intrinsic religiosity. Intrinsic religiosity is kind of the extent to which a person's life is centered on their religion. It's kind of intrinsic. So those are the major characteristics, religious attendance and this more cognitive aspect of religion, this intrinsic religiosity, where religion is guiding the person's decisions in life, and kind of their life is kind of surrounded, their religious beliefs kind of are the focus of their life, and that guide their life. Now, in terms of, is this only true in Christians? And actually, it's true in other religions as well. Devout religious practices, are related to better health. Whether there are certain characteristics within the Christian faith, the emphasis on God's love and forgiveness, on whether that actually has more effect than other religions is really not known. It's very hard to compare religions. It's very difficult, just technically, methodologically, it's difficult to compare, because if you compare people, of different religions in the United States, in a majority Christian nation, they're gonna have, a lot of other stressors, social stressors, because they're kind of an out group, and because they're not part of the mainstream in terms of their beliefs. So it's very difficult to compare people from different religions. But if you study people in Iran or in Saudi Arabia, where I work a lot with these investigators in the Middle East, we find very strong relationships between religion and mental and physical health. Very strong.
Wow. So I have a few questions on the intrinsic religiosity, or what you're describing. What do you think that is? Is it the moral compass that's guiding someone to maybe choose better behaviors, or to keep them out of trouble? I mean, what do you think that is? Are there characteristics that you've been able to define?
I think it's all of those. Plus it's a belief system that gives meaning to life, particularly when bad things happen. When people get sick, if they lose a loved one, if they go through severe trauma, this begins, that's when people start asking questions. What is the meaning of life? Why am I here? Why did this happen? And people who have a strong religious faith, a strong connection with God, seem to be able to weather those events much better.
Mm.
They're able to find meaning more rapidly and integrate those experiences better. It's fascinating. It's really, it is interesting because all of the three major world monotheistic religions all focus on this connection with God. It's the first commandment in all of those three religions. So those, I guess, if you have this attachment to God, that making that as one's first priority, other things as they change, and as you lose stuff, they don't matter quite as much. They still hurt really bad. But again, if the priority is right, then these other things kind of fall in line, more in perspective. Now, if other things are more important than, for example, someone's relationship with God, then when those things change, when life is dependent on those things, whether that be persons, whether it be possessions or positions or job or whatever, when those things are out of line and they're going to change inevitably, that's when problems occur.
Absolutely. Well, I know with my own faith that God's been the one thing that's never changing. And
that's it.
I am curious. I don't fear death. And do you think that might be part of that too? Because there's comfort knowing that we're here for a purpose. And at the end, it's going to, at least in my belief, that there's going to be a better place. So do you feel like that is part of it, that fear of the end or what's going to be happening is kind of blunted in some sense? I know that I've seen people who are fighting terminal disease and just the most horrendous of things, losing children or something, but they have such a peace around them because of their strong faith. And it just awes me that they're able to do and go through life with such tragedy and loss and such obstacles to overcome. Do you think that's part of that? Is that, what do you think is that belief? What is that belief doing to them that's allowing them to do that or have that?
I do. I agree. I think part of it has to do with the sense that that this life here is just temporary. This is not all there is, and that that there is something that is beyond this life, and a place where the suffering is no longer there. It's a better place. We're all going through a lot of tough things here on this earth. You can be guaranteed of that. But having that hope, I think the hope is really important. Having that hope in that things have a purpose, that God, can take something bad and turn it around into something good. And I think that makes a difference. And knowing that, that there's life after death, that it's not the end. If you're purely a scientist, the outlook there is pretty dim. When you consider, the purely scientific view is that, we're just here evolving into some other kind of organism that someday will look different than us, that there's no purpose or meaning to this life. And when we die, that's like it. There's no resting in peace, there's non-existent for all of eternity, which is, that's the scientific worldview. But religion says, no. There are other sources of truth, and we don't understand everything right now. And, there just might be something more to this life. And these religions have not lasted, for thousands of years for no reason at all. The reason they've lasted is because there's probably a lot of truth in those religions. And we'll see in 2,000 years from now whether all these scientific theories, if we're still around, whether they're still around.
Right. Absolutely. So I'm curious because, as speaking as a scientist and a physician and talking about things that, I say that I believe in God, but I can't prove without a doubt that there's a God to someone, let's say, who's a non-believer, or who doesn't have any type of faith in a spiritual being or spirituality belief or practice. What kind of criticisms or obstacles have you kind of run up against in that scientific world? Have you had any issues or struggles with your peers saying, this is hogwash, why are you studying this? Because I'm just curious. I'm like, and if so, how do you respond to that?
Yeah, no, you're absolutely right on that. I've run into a lot of resistance. Mostly it's not been any direct resistance. It's mostly been, I guess, being ignored and kind of being marginalized, which is actually fine with me because that means I could spend more time doing what I want to do. So I'm not part of a whole lot of committees, or any too much administration. I can really focus most of my time on conducting research and training others to do it, and writing and all of those kinds of things. So it doesn't bother me that much. Plus, a lot of doors have opened for me that, in terms of funding from outside organizations and in terms of just colleagues that I've run into where good relationships have developed and we've been able to work and do a lot. And a lot of that just seems that the doors have opened up. So I'm very excited. It's about that. Now there are a lot of challenges here, and one is that I'm constantly wondering whether God really exists. To be honest with you, even though I'm a religious person myself, I'm so scientific that I've got to have this evidence, and in reality, evidence is all around us. And it's if you barely look for it, it hits you in the head. But there's also a lot of people out there are having a hard time. Just to give you an example, my wife has a severe chronic pain syndrome, and she's it's really been tough. She just had a spinal cord stimulator implanted the day before yesterday. And, she can't sleep, she's in severe pain. I just got back from the doctor where she's on Dilaudid, she's on oxycodone. None of that stuff seems to even be touching this pain. And, we wonder at times, why would God allow this? She's very faithful, very, deacon in the church and very active in her religious beliefs and helping other people. And with pain and with disability, spends a lot of her time doing that. And yet, these bad things happen, and they just do. And trying to understand them, we're just not going to know. There's just no real answer to this. We just have to have faith that God knows what he's doing. Right. we just don't know that much. Right. There's a lot going on here that we just don't understand. And the main thing is to just stick it out, just stick it out. Just try to have faith. And that's hard. That's very hard. But, what else are we going to do? We can't give up,
No, you can't give up. I understand what you're saying whenever you enter a point of tragedy. I had a brother that was killed at 22. And so when you see that at such a young age and you're just like, I don't understand. But at the same time, how he passed, the individual that was responsible for his death, I think only God would allow us as family to forgive. I find that to be very comforting, and knowing that God can take me and take my heart, which is really, a vengeful, wanting to be the human element, the sinful self, and just hate and, but he allows us through his grace to see different things. And that's how I see it. And, I always look back, at least I'm a Christian, biblically, Paul he always wrote about, he had a thorn in his side, and God said, this is for you to understand that just your faith in me is enough. And I take comfort in that. Again, we're never going to understand suffering. But then again, we have free will, right? So he allows us our decisions, and we have the consequences and to learn. And sometimes he we'll do different things. Again, yeah, like how am I supposed to question who made us? But when you talk about evidence all around us, I find that comforting too, because I look at this earth and I look at the universe, and here we are, this ball floating around, this ball of fire, and it just, where does the universe end? There's just so many questions that I'm just like, I'm not even worried about it. Someone much brighter than me is in charge. And so that's incredible. So I know you just had a few more minutes left with us, but could you tell me a little bit, because I'm a vet, I was in the U.S. Air Force, I was active duty, I was also deployed to the Middle East, not in a place that I saw a lot of tragedy or anything, but I certainly came across as a physician, patients returning with PTSD, severe, they saw their buddies blown up and died, and limbs blown off, and just horrific things that we witness as humans, and just how did that process that. And I've really interested in positive psychology and how we can, use post-traumatic growth instead of post-traumatic syndrome, and preparing people. But you are talking about, I came across one of your studies or something here. It says rationale for spiritually oriented cognitive processing therapy for moral injury in active duty military and vets with PTSD. Can you give me a sliver of what that's all about?
Well, I've become very interested in this whole topic of moral injury and PTSD. And in fact, it's kind of my focus now. And in fact, I wrote this book that we talked about earlier, You Are My Beloved, and dedicated it to veterans and active duty military, as part of this therapeutic process. Because, these terrible things that happen cause people really to question whether there is a God, and whether God loves us, and whether God cares. And so I wrote this book really to kind of counteract that belief that God doesn't care, that we are His beloved. And that's something that veterans who have had severe trauma and active duty military, they need to really know that, because if they know that will help, I think, some of the self-condemnation, some of the guilt, some of the shame, which is just an inevitable consequence of being in war. And that's very frequent. We've done studies in veterans recently showing that 80 to 90% are experiencing some of what's called moral injury, from their combat experiences. And again, this moral injury is, having to shoot and kill people, even if it's your job, and then being upset when your buddies get injured or killed, and then reacting to that, or the fear, that you experience, when you're being overrun by the enemy. All of these things create very deep wounds. And, the love of God, which is always there, that's, you really got to focus on that, God loves you and forgives you, and is reaching out to you and just wants to have a connection. And no matter what you've done, there is forgiveness for that, no matter what you've done. And really, that's the purpose, of this book and this whole research area that I'm now really, like 100% of my time literally spent on developing this intervention to help treat moral injury in our soldiers, and we're those people, you and your buddies, who are enabling us to be free, and people throughout the world to be free. How important our military is, and we send people, our kids out there in their teens, they haven't experienced any, we throw them out there and then they go through hell. And, my dad was in the service, he was in World War II, and my father-in-law was in World War II. And, I just have a heart for veterans and active duty military. I don't know. I just do.
I know we're done, almost done, but I came across the verbiage or the something called religious CBT, or cognitive behavioral therapy. Can you just give us a quick definition of what that is exactly?
Sure. It's religious cognitive behavioral therapy, and this is all available on our website. It's all for free. We've got manuals on how to do it in 5 different religions, Christianity, Islam, Hinduism, Buddhism. And what it involves is it's standard cognitive therapy, which challenges persons, if people have certain assumptions or dysfunctional beliefs, it challenges those beliefs and tries to help the person think more in reality. And, religious cognitive therapy really is based on the person's religious scriptures. What do those scriptures say? What does their faith tradition teach with regard to these various things that people struggle with? And most of the scriptures are really, really positive and give this guidance for thinking and behaving that help to neutralize, emotional problems like depression, anxiety, and PTSD, we think.
Wow.
There's this wisdom, again, this wisdom in the scriptures has lasted for thousands of years. And a lot of times these scriptures were written in a setting of war and trauma. So there is so much truth in there. Why are we just ignoring that? Why are we just ignoring it?
I don't know, but I know that whenever I've been through a lot in my life, is that whenever there's challenges or questions and needing of wisdom beyond prayer, it is truth in scripture. It has never, ever led me wrong. And so I certainly see it as a foundation of our family. We've raised 3 amazing grown children now, and they're incredible. So we're very blessed and thankful. So I certainly think going back to scripture and bringing that around to the family and bonding ourselves together with that has been very helpful. So you're absolutely right. So I know I promised 25 minutes I'm into, so I just want to say thank you. And maybe we can, when you have a little more time, we can go more in depth into some topic, because this was fascinating. And thank you so much for everything that you're doing and your studies. And I just think it's much more important than people realize.
Thank you, Lori. I've enjoyed talking to you and your audience.
Thank you again. And everyone, I'll have the links for Dr. Koenig's book and everything to the website at Duke as well, because I'm really curious. I'd like to download some of the religious CBT information. So thank you, everyone.